Hello everyone, Brooke here from Active Health Clinic, and I am going to be chatting you through or talking you through my experience with a tilt table test, which was fun. So a bit of a trigger warning for some people. They're not fun, these tests, and just be mindful whether you want to continue watching or not, because I will be chatting about the procedure itself and my experience. So what is a tilt table test? Basically, it is a test to test your autonomic function, what your autonomic nervous system does with gravity when you're standing upright and changes in posture. It's looking at heart rate, blood flow, the electricity of your heart, and how it responds to gravity. You may be asked to complete a tilt table test if you have episodes of syncope, blackouts, vision loss, any sort of postural symptoms really, along with different cardiovascular conditions, although it's less common, more so with suspected dysautonomia. So what they do is you walk into the room and you have two people there supervising you. One's going to be holding you and taking your blood pressure, and then the other one is going to be monitoring the ECG, so the electrocardiogram, that looks at the electricity or the flow of your heartbeat, basically, the electrical impulses through your heart and how that's all tracking, to see if there's any sort of arrhythmias, looking for tachycardia, anything like that. So what happens is you walk in, you're asked to strip. Electrodes are placed across your chest and across your back, and you are then asked to lay down on this big bed, and you're strapped up. You're completely strapped up. So when you stand up, if you do faint, you won't fall and hurt yourself. So what they do then is strap you up, they take baseline measures, and then they actually insert a catheter into you to actually insert a medication, which I'll talk about in a moment. So it goes into two separate parts. The first part goes for about 10 minutes, if you make it that long. And what they do is they slowly go from laying and they tilt the table up to standing. So you're passively standing. You can actually completely relax in that position, and it's encouraged that you do so and you stay as still as possible. They then turn the timer on and you go, and it's like an active stand test like what we do in the clinic. They monitor your heart rate, your blood pressure, the ECG, everything to do with your heart. And they're also looking at you and different changes that they see within you. So that lasts for about 10 minutes. And then say you pass that and everything's good, and you didn't faint, they then lay you back down. And they actually give you a medicine called isoprenolone, yeah. And what that does is it triggers that fight-flight response. So it's like a synthetic adrenaline, okay? Now, this is the part where they really try to make you faint. That's the whole point of a tilt table test, to see what your tolerance is to standing up and see what happens, okay? So you're laying supine on your back, and then they tilt you up again, and you've had this medicine that's going through your system the whole time. Again, they're looking at your blood pressure, they're looking at your heart rate, they're looking at any sort of abnormalities within not so much the structure, but the electricity, the electrical impulses, and that sort of current in your heart, just to make sure everything's all right there. And then they stop it when you faint or when you ask to stop the test, which it's very different for everyone. So some people may get the whole way through their test and their heart rate is sky high, like 180, 190. Blood pressure's also through the roof. And they're like, yeah, let's go, because they're in that fight-flight response. Your body, your heart more so, is compensating for the blood flow that's pulling in your legs. or the blood that's pooling in your legs. You've had that adrenaline release, which is why, again, your heart rate has gone through the roof. Or some people go the complete opposite way and their blood pressure may drop. And this is where they look at, is it neurocardiogenic syncope? Is it postural orthostatic tachycardia syndrome? Is it postural hypotension? What sort of dysautonomia are we looking at? And then that there will really guide pharmaceutical treatment from there on, okay, if it's needed. So some people's blood pressure bottoms out, their heart rate completely drops and their body just goes nope and they faint. Or heart rate could go through the roof and your blood pressure could plummet like mine did and you faint. So basically it's just really looking at what type of dysautonomia is going on. Are there any other arrhythmias or anything else that a cardiologist should be aware of? Now, in terms of an active stand test or a Holter monitor or a tilt table test, I've had all of them, and from personal experience, I can definitely suggest you, if you do not want that sort of stress on your body, advocate for an active stand test, get someone to do it properly, and then a Holter monitor. It's going to show up the same sort of thing. Yeah, that's basically that. It's going to show up the same sort of thing. My experience with my tilt table test was very fun, not really, but it was an eye-opener and I'm glad I did it. So I can see what other people have gone through as well. So for me, I walked in, laid down, ladies were absolutely lovely, tied me up and then stood me up, and I got 8 minutes into the first part and completely fainted, and it was terminated from there. And then, yeah, the diagnosis of POTS was given to me then and there. So I think that's probably one of the good things if we look at active stand test, if we look at Holter monitor, if we look at tilt table test, you get those results right then and there because it's actually one of the doctors that are giving it to you. It's not a nurse or someone like that. So that's my experience. Again, if I were to go through and compare them all, tilt table test, very, very, very full on. And if I were to encourage everyone else, I'd probably say start with active stand test, Holter monitor, and then go from there. But obviously that is something that you should chat about with your GP or healthcare team to decide what is most appropriate for you. But if you have any questions, please leave comments below and we'll do our best to answer. Thanks for listening. Bye.